Welcome to Pharmacoeconomics, the discipline that bridges the topics of pharmacy, therapeutics, and economics. So if you need further information on the topic of pharmacoeconomics, here's a link to Access Pharmacy, and this can provide further information should you need clarification on some of the topics that we'll be discussing here. So let's start at the beginning. When we speak of pharmacoeconomics, it's in the realm of economics of healthcare, and in this session we are going to provide an overview of pharmacoeconomic principles. And we will have several objectives, but to begin, the overall objective is to be able to understand not only effectiveness of treatment and outcomes, but the costs associated with them. So to give you an idea of how pharmacoeconomics has an effect on practice, consider this particular ad. Can you evaluate an ad like this? If you look closely at the ad, you can see that the authors are actually making claims about saving money. And of course, the particular topic that is addressed here is stroke, and no doubt stroke does affect quite a few patients, and it is costly. That is, the treatment can be costly. And, in the ad, of course, they're promoting drugs to help with this problem in terms of cost, and they make statements such as Americans' healthcare crisis calls for the kind of cost-saving power that is using particular drugs. But obviously, you don't have all the information needed to make a sound judgment whether the ad is valid. But this is where pharmacoeconomics comes in, is with pharmacoeconomics, we can actually make an assessment of this information, the assessment being from an evidence-based standpoint. So when we see a statement that says something like, for more information on how new medicines improve lives and save money, then of course contact the Pharmaceutical Manufacturers Association here. But improve lives, save money, this is what pharmacoeconomics is all about. It's making an assessment of statements like this. So learning objectives for today's session: define pharmacoeconomic terms, use them properly. As we shall see, this will be like learning a new language. The language of pharmacoeconomics is going to require that we learn the terms and be able to use them properly, and differentiate among types of costs, differentiate the term efficiency compared to efficacy and effectiveness. These are terms that are often confused, and so we'll clarify the precise meaning here, and compare and contrast the types of pharmacoeconomic analyses. So there are several types of pharmacoeconomic analyses, and we're going to focus on the four major types. So with this, let's consider this statement. Every treatment that may improve health should be given irrespective of its cost. Human life is priceless. Do you agree? Well, it would be difficult to disagree with these statements. However, we have to consider the fact that in healthcare, as in many other areas, we have resources, and often these resources are limited. So it would be nice to say, yes, whatever healthcare problem we need to solve, sure, let's just take care of it, irrespective of how much it costs. Well, unfortunately, that's not a realistic view, and as we shall see what pharmacoeconomics does, it tries to give us an idea of where the money should be spent to be the most effective in terms of healthcare. So let's consider this. The economic evaluation of pharmaceuticals and pharmacy services grew out of the need to establish value or to respond to the question of value. Statements of product or service value center around two attributes: cost and benefit. So realistically, of course, the fundamental aim of any healthcare system is to maximize the health and welfare of the population, but because resources will always be scarce in relation to the healthcare needs, in which they could be used to meet, choices must be made. Those responsible for allocating resources need to prioritize between competing uses so that maximum benefit, health gain, can be obtained from any given budget. So here's where pharmacoeconomics comes in. Pharmacoeconomic evaluations have been used as a tool in selecting such things as formulary products, developing treatment guidelines, and so on. And pharmacoeconomic information assists decision makers in optimizing the use of resources. From the consumer's perspective, the price page should reflect the benefit gained from the use of the product or service. The several factors have created the need to monitor the value of pharmaceuticals, increased costs, concern of payers, increased number of alternatives available to treat illness and disease, growing demand for pharmaceuticals, introduction of high-cost biotechnology products. So the way to deal with this is through pharmacoeconomic analyses. So this leads us to a formal definition of pharmacoeconomics. So pharmacoeconomics defined, a term used to describe a compilation of methods that evaluate the economic, clinical, and humanistic dimensions of pharmaceutical products and services. And also the science of measuring the costs and outcomes associated with the use of pharmaceuticals in healthcare delivery. In other words, there are several ways to view the effectiveness of medical intervention, that is drug therapy, diagnostics, and so on, from the economic standpoint of an HMO, health maintenance organization, or third-party payer. Medical intervention must be viewed by its cost effectiveness. And this is again because we do not have unlimited resources available for healthcare. So pharmacoeconomics helps provide a method to determine the benefits of medical intervention, i.e. drug therapy, from an economic perspective. The importance of pharmacoeconomics, understanding how costs relate to outcomes, will be essential to your future as well as the future of the profession of pharmacy. Healthcare and pharmaceuticals are expensive. Limited resources must be used efficiently and effectively. As practicing pharmacists, we must provide value for our patients. So further on the importance of pharmacoeconomic studies are used in evaluating and selecting formulary products, developing treatment guidelines, conducting disease state management programs, establishing prior authorization policies, implementing step therapy, and designing prescription drug benefit programs. So we see that pharmacoeconomics is actually quite necessary in today's world for practicing pharmacy at a high level. So this brings us to the pharmacoeconomic equation. So decision makers, those who have to decide what's important in terms of costs and therapy, they can use pharmacoeconomic methods to evaluate and compare total costs of treatment options and the outcomes associated with these options. So of course, to show this graphically, think of two sides of an equation. The inputs, costs used to procure and use the drug, if we are talking about drugs, and the health-related outcomes. So if only the left-hand side of the equation is measured without regard for outcomes, this is a cost analysis or a partial economic analysis. If only the right-hand side of the equation is measured without regard to cost, this is a clinical or outcome study, not an economic analysis. So in order to be a true pharmacoeconomic analysis, both sides of the equation must be considered and compared. So with the pharmacoeconomic equation, we have costs. These are healthcare inputs. And in the middle, of course, healthcare program or procedure. And then to the right, benefits. These are health outputs or outcomes. So this is the essence of a pharmacoeconomic evaluation. So let's elaborate on this by simplifying it. Here we have the equation in a very simplified format: inputs program to outcomes. So what do these terms represent? Well, let's start with inputs. Inputs are such things as counseling a patient on use of a drug, counsel caregiver, that is if the patient's not able to take them his or herself, and demonstration, which could be a part of the counseling, and develop compliance aids, as we've come to know that compliance and adherence to treatment isn't always what it should be, and also educational aspects in terms of treatment, and also inputs could include monitoring therapy, and with this could result in referral, which would be part of inputs, and also consult on self-care. Patients choose to use over-the-counter products, then this would be a part of input. And by all means, this list is not exhaustive, and it essentially is specific to pharmaceutical care. So when a pharmacist fills a prescription, no doubt that incurs a cost, and with this you would have these to consider also as inputs with cost. So the therapeutic program might be established, but by no means is it a stable situation. A dynamic process could involve things such as recommendations, maybe adding a drug, discontinuing a drug, changing the drug, changing the dose, changing the route of administration, perhaps changing the schedule and duration, and perhaps just leaving things as they are, continue without change. Point being, the program is continually being monitored, and other aspects of the program could be added at any time during the patient's treatment. So the last part of our process is outcomes. The question being, were recommendations from the inputs accepted or implemented, and if so, what were the therapeutic outcomes? Were they positive, successful? Did the patient get better, or was there no change, or perhaps was there a negative outcome? So let's consider the types of outcomes that we're looking at in a pharmacoeconomic evaluation. Outcomes can be described in different terms or placed into three categories. Economic outcomes, examples being cost per day, cost per course of therapy. Next, to clinical, examples blood pressure and hypertension, mortality. And three, humanistic, examples quality of life and patient satisfaction. So these would all be reflections of treatment and the inputs or costs involved in treatment. So let's look at the types of outcomes that you might see in a pharmacoeconomic analysis. Outcomes and clinical endpoint measures for disease states. For instance, the disease state of asthma, you might see a measurement of peak flow, complications, or perhaps utilization. And of course, complications signifies a negative outcome, but also utilization, perhaps using a type of drug therapy. We would want to measure whether the utilization is effective or not. And next, hypertension. What type of clinical endpoint measures would we be considering? Well, blood pressure, and also with this complications, again a negative outcome, and utilization of the drug therapy. And also further, if we consider, say, the chronic disease of diabetes, we would have measurement of blood glucose as a clinical endpoint, and the source of data would be the blood glucose monitor. Perhaps the measurement clinical endpoint would be glycosylated hemoglobin, which would be hemoglobin A1C test as the source of data. And also further on diabetes, we would see something like complications, maybe retinopathy, neuropathy, nephropathy. These are negative complications, but nevertheless they're outcomes. And the source of this data might be claims data from an insurance company, third-party payer, or perhaps patient histories. Patient histories themselves that might be recorded in electronic health record. So also, if we consider diabetes, we could have a measurement of use of healthcare services, whether it be emergency room, hospital, or physician visits. And the source of this outcome to be measured would be patient history and perhaps claims data, which would be the number of claims or perhaps a dollar amount associated with these claims. So in a pharmacoeconomic analysis, the pharmacoeconomics researcher would have to be able to access this data. And of course, this is in the context of determining whether the treatment was effective. So further, when you consider outcomes, there could be drug therapy problems. Of course, these are negative outcomes, drug therapy problems that may affect outcomes. Inappropriate prescribing, inappropriate use, therapeutic failure, or perhaps even adverse drug reactions, or ADRs. So if we think about the three parts to our pharmacoeconomic equation, we have the inputs and the costs associated with those, and then the program or therapy, and then the outcomes. Then these are the considerations when it comes to the outcomes. So again, once we've considered the pharmacoeconomic equation, we can ask the question, why would you conduct a pharmacoeconomic evaluation? Well, the cost of pharmaceuticals has increased in double digits from 1997 to 2016, higher than many other sectors of medical care. And most concerned by rising pharmaceutical costs are those responsible for paying for and managing these costs. And if we consider this, the report, retail prescription prices increasing 6 times faster than inflation. This further validates the need for pharmacoeconomic evaluation. And payers of pharmaceuticals, that is prescription drugs, include employers, managed care organizations, and healthcare institutions such as hospitals and the Veterans Administration. And individuals within these organizations attempt to manage pharmacy costs in the face of limited budgets. So with the basic purpose, again, of a pharmacoeconomic evaluation is to compare the costs and consequences of therapeutic alternatives. And now that we've seen the pharmacoeconomic equation, we can see the process of inputs or costs, and then the program or intervention, and then the outcomes. But not all interventions are equal, and what a pharmacoeconomic evaluation tries to do is make comparisons to make the best choice. So what kind of comparisons are we talking about? Well, some examples of the comparisons might include drug versus drug. Might have a histamine 2 receptor antagonist such as Tagamet, Zantac, versus a proton pump inhibitor, Prilosec, for the treatment of gastroesophageal reflux disease, or GERD. Or you might have drug versus surgery, proton pump inhibitors, that is Prilosec, versus surgical procedure for the treatment of GERD. Or perhaps a comparison would involve a drug versus behavioral modification, bupropion SR versus behavior modification for smoking cessation, or maybe drug plus behavior modification versus behavior modification alone. Or perhaps the evaluation may not include a drug at all. It could be something like a program such as vaccination. Here we have a report of a pharmacoeconomic evaluation, the efficacy and cost effectiveness of vaccination against influenza among elderly persons living in the community. So the researchers here were trying to assess whether implementing a program, you'd have costs involved, and then implementing the program, would you get positive outcomes? Would it actually result in outcomes that resulted in better health, those members in the community? Okay, so when we consider, again, the purpose of a pharmacoeconomic evaluation to compare costs and consequences of therapeutic alternatives, and each alternative can be represented by the pharmacoeconomic equation, then let's look at the types of evaluations to achieve this. Well, four main types, pharmacoeconomic evaluations. First being cost minimization analysis, or CMA, cost effectiveness analysis, CEA, cost utility analysis, CUA, and cost benefit analysis, or CBA. If you check the asterisk here, you can see that there are other types: cost of illness analysis, cost consequence analysis. We won't go over these. We're going to stick to the four main types because this is in all likelihood what you'll be seeing in the medical literature. So with the four types of pharmacoeconomic analyses, how do they differ? How are they the same? Well, this table summarizes the similarities and differences among the four types of analyses. So if you consider the type of study, the cost-benefit analysis, the cost unit is dollars, and of course that would be the input side of our pharmacoeconomic equation, and the outcome unit is measured in dollars. And contrast this with cost effectiveness analysis, we could see also the cost unit is dollars, but the outcome unit is in natural units. Natural units being such things as blood pressure measurements, hemoglobin A1C levels, and so on. And next, cost minimization analysis. Again, the cost unit is dollars. Outcome unit, as we shall see, the outcome unit, there really is no outcome unit. It has to be equivalent measures. This will become clearer as we talk about this specifically. But for now, just keep in mind that a cost minimization analysis looks at the cost, the input costs, and then you would be looking at an outcome unit that is equivalent between two or more different therapies. And then lastly, of course, we have cost utility analysis. Cost unit, again, dollars, and the outcome unit is a QALY, which is a quality adjusted life year. And again, we'll look into this in upcoming sessions. So with this, let's consider the terms efficiency, efficacy, and effectiveness. These terms are often confused, so let's provide some clarification here. Definitions: efficacy is the impact of an intervention in ideal circumstances, what it can do, say in the setting of a controlled clinical trial. Drugs are approved, and there are limitations in the approval process, but this is designated by the term efficacy. So contrast this with effectiveness, the extent to which desired outcomes are achieved in practice, actually what it does do. So we're talking about a drug that maybe has been approved, and then of course we don't have the full picture as to how it's going to work until it's released into the population, and that's where the term effectiveness comes in. Now contrast these two terms with efficiency, really just a bit different. Efficiency means properly allocating resources or increasing production. And what inherent in this is lowest cost per unit of output. This is actually desirable in a pharmacoeconomic analysis. If, for instance, if we're talking about blood pressure, you certainly want a drug that would provide you the most effective treatment and cost the least, and that would be the highest efficiency. So at this point, try to remember the differences between and among these terms, because as we go on in our discussions on pharmacoeconomics, we'll be using them in various contexts. So a worthy goal, of course, would be to obtain the maximum outcome for a minimum cost. So we've looked at the types of pharmacoeconomic methodologies, the four types. Now let's say a word or two about comparing these methodologies. Well, each pharmacoeconomic method measure costs in monetary units, e.g. US dollars, and most often US dollars. And the methods are distinguished from each other in how consequences are measured. So once again, we saw that similar to all four methods, each pharmacoeconomic method measured in dollars, in monetary units, the same monetary units, and methods are distinguished from each other in how consequences are measured. So as we go through this session, we'll be looking at each of these methodologies in greater detail. So let's wrap up our discussion of pharmacoeconomics by actually looking at the steps for conducting a pharmacoeconomic evaluation. In other words, let's get into the mind of a researcher who might be looking to make an assessment about two comparative therapies and the cost and benefit with this. So recall the aim or goal of a pharmacoeconomic evaluation: a process to judge the costs and consequences or possible benefits of one drug against another drug, drug therapy to other therapeutic modalities such as surgery, behavior modification, or even placebo, or perhaps even a program such as a flu vaccine program. So when conducting a pharmacoeconomic evaluation, we must consider the following points. 1, define the problem and, of course, state the objective. And 2, identify the prospective and alternative interventions to be compared, identify and measure the outcomes of each alternative, and lastly, identify, measure, and value the costs of the alternatives. So whichever methodology we would be talking about, say the 4 major methodologies we looked at, these are the steps that are common to all. The 4 steps that a pharmacoeconomics expert would be undertaking in order to answer the question whether the treatment is cost effective. So let's take each one individually briefly. First, define the problem, state the objective. Examples might be what's the most cost-effective treatment for type 2 diabetes, whether it be a diet versus exercise regimen or versus drugs alone for newly diagnosed diabetics. So we see here that the costs would be different, of course. Diet exercise perhaps less expensive than drugs. But the goal of the pharmacoeconomic evaluation would be to see whether they are similar in effectiveness. And perhaps we would consider what's the most cost-effective treatment for osteoarthritis of the hip. Would it be physical therapy and pain medication versus orthopedic surgery in an aging ex-runner? So depending on the intervention, we could see that the outcomes may or may not be the same, of the same effectiveness. A last example, what about this for defining the problem, stating the objective? What would be the most cost-effective treatment for myopia or a nearsightedness? Would it be LASIK eye surgery versus eyeglasses or contact lenses? Actually, many people have had to make this decision, and here it's framed in terms of a pharmacoeconomic question. So with this, let's look at perspective, and perspective is divided into 2 parts. What do we mean by perspective, of course? Who benefits the most from the money spent on treatment? The employer, the patient, the health insurance plan, society, the government. So example would be who benefits most from a routine varicella or chickenpox vaccination. Say from a cost standpoint, one study found that a payer, that is an insurance company, appears to benefit less than society, who would benefit more from avoiding lost work days. Point is, with a pharmacoeconomic evaluation, the perspective has to be identified. So second part of this, identify alternative interventions. Have all relevant treatment alternatives been considered in addressing the research question? Is the additional gain in benefit or effectiveness worth the additional cost? Maybe there's a treatment option out there that we just haven't considered. So these are the thoughts that a researcher would go through when considering a pharmacoeconomic evaluation. So third step, that is, identify and measure outcomes of each alternative intervention. Say when a clinician thinks about evaluating pharmaceutical products, the product's clinical effect immediately comes to mind. In general terms, treatment should or could result in one of several outcomes. So here we have the most desirable to least desirable outcome. So we looked at endpoint or outcome measurements such as blood pressure readings or maybe hemoglobin A1C levels. Now the pharmacoeconomist would consider the result of the outcome. I should say the result of the therapeutic intervention. Is the outcome positive, negative? Well, in assessing outcomes, it's also important to take into account both positive and negative outcomes. Positive outcome is a measure of the drug's efficacy if we are talking about a drug intervention. Negative outcomes include side effects, treatment failure, and the development of drug resistance. So here we have a list that has been compiled about outcomes, where we would have, of course, the most desirable, number one, is a cure. Someone has an intervention. Hopefully they would experience a cure, but further down the list here we can see various levels. Improved quality of life, not easy to measure and not exact. Perhaps decreased incidence of morbidity, not easy to measure, not exact. Perhaps the treatment would result in extended life. Perhaps number 5, just relief of reduction in symptoms, or even 6, no effect. Maybe even 7, increased morbidity, that is drug interactions or adverse drug reactions. The intervention didn't really help at all. And last, of course, the least desirable is mortality. This is actually easy to measure, quantify, but certainly not a desirable outcome with some sort of a treatment intervention, death. So here's an example that kind of pulls together some of the concepts that we've talked about to this point. Article that appeared some time ago, but again relevant to pharmacoeconomic analysis. So if we start thinking in pharmacoeconomic terms, you'd ask the question, is the cost worth the outcome? That actually could be your research question, and then you could go through the steps to try to answer this. Anyway, the article, the gist of the article, prisoner gets $1 million heart transplant, and California prison inmate serving 14 years for robbery received a heart transplant earlier this month, renewing a debate about who deserves to get desperately needed organs. So a pharmacoeconomic analysis may or may not be warranted, because actually this gets into some ethical issues, but point being, if we try to visualize our pharmacoeconomic equation, we would have, of course, the costs of the transplant, and then, of course, the transplant itself would be the therapeutic intervention, and the remaining question would be outcome. What outcome would we expect? What would we hope for? And what would we actually observe? So, last step in the pharmacoeconomic evaluation would be number 4, identification, measurement, and valuation of costs. And when we speak of costs, and particularly valuation, this is something we'll discuss in the next session. But for now, notice that the pharmacoeconomic evaluations above all involve cost. And here we need to distinguish between and among the different types of cost. The first step in measuring costs is identifying all relevant resources consumed in association with a product or service under evaluation. And with when we consider identifying relevant costs, we want to avoid cost myopia. In other words, did we consider all the costs in terms of the analysis? So let's look at the types of costs as a method of identification. Costs are categorized as direct medical, direct non-medical, indirect, and intangible. Now, we're going to be looking at these in more detail in the next session and beyond. But for now, let's just recognize the names and look at these as in a general view. So first, let's look at direct medical costs. These are resources consumed for medical services or products that are directly related to the product or service being evaluated. Example, physician services, laboratory services, prescription drugs, hospitalizations. And who usually pays these direct medical costs? Well, these costs are typically borne by large-scale payers such as insurance companies, managed care organizations, or the government. And These types of costs are generally fairly straightforward and not too difficult to identify, and essentially what appears on a bill if you were to be billed for a particular healthcare service. So let's look at the next one. The next one is direct non-medical costs. What are these? Non-medical resources consumed as the result of providing the product or service. Examples are transportation, additional housing expenses, special diets, or exercise equipment. Who usually pays? These costs are usually the responsibility of the patient. So inherent in this is the fact that you probably would not have an insurance company or third-party payer picking up these costs. So next consideration, next is in terms of costs, indirect costs. These are costs indirectly associated with the product or service under evaluation because illness and disease have an impact on resources outside the medical sector. Example would be loss of work productivity. And who usually pays? These costs can be assumed by patients, caregivers, employers, the government, or society. And again, we are going to elaborate on this and other types of costs in upcoming sessions, but for now, just consider the fact that they're also a part of treatment in terms of costs incurred, and the designation as indirect costs is aptly determined, costs indirectly associated with the product or service under evaluation. So next and last, for our purposes here, last but not least, are intangible costs. Intangible costs are costs associated with pain and suffering resulting from treatment or the illness itself. And these types of costs often are difficult to measure or quantify. So for now, try to recall the four major cost categories, and again, these will be elaborated in more detail, or we will elaborate on these in more detail in upcoming sessions. So with this, in pharmacoeconomic evaluations, the accuracy with which costs can be identified, measured, or valued will vary. Variation around the measurement of outcomes also exists. So pharmacoeconomic evaluation is not an exact science, and so with this, the task at hand would be using the appropriate methodology for the research problem at hand. So let's end the discussion with summary points about pharmacoeconomics and pharmacoeconomic evaluation. So to summarize, economic evaluation provides a framework for assisting decision making when choices have been made or have to be made, and a fundamental feature of the approach, that is, both the costs and benefits of the available options are taken into account, and the costs and benefits will vary according to the viewpoint adopted in the analysis, and the viewpoint here is synonymous with perspective. The broadest and most preferred viewpoint is that of society in general. And next, ideally, economic evaluation should be undertaken alongside clinical trials so that appropriate data may be collected. And the four main variants of economic evaluation used in the context of healthcare are cost minimization, cost effectiveness, cost utility, and cost benefit analysis. So this concludes the discussion on pharmacoeconomics, the introduction to pharmacoeconomics, and in future sessions we'll be looking in more detail as to how these methodologies are used in terms of improving healthcare.